Hello. My name is Jones, and I welcome you to the last unit or the last part of our forensic psychiatry, which is part 3. In this part, we are interested to look at the treatment for mentally disordered offenders, and then we'll also appreciate the forensic psychiatry nursing care, or the nursing care that we can give for patients with patient within the subspecialty of forensic. Okay, so these are the items that we want to look at within this lesson, and then we'll also look at the special challenges that a nurse can face with forensic patients. Okay, we'll look at those special challenges and also discharge, the referral and the discharge of patients with the mental illness or with forensic psychiatry. Okay, that's what we are going to look at, and then give a summary of part 1, part 2, and part 3 of our lesson. Okay, so those are the items that we want necessarily to look at within this part or within part 3 of forensic psychiatry. So in forensic psychiatry here, we are now looking at treatment settings for mentally disordered offenders. In Zambia, according to the Mental Disorders Act of 1951, mentally disordered offenders are treated in all hospitals administered by government and all places declared to be prisoners under the Section 3 of the Prisons Act, under compulsory detention, that is this detention order, to safeguard the lives of property and the public. So when you're looking at treatment setting for mentally disordered offenders, this is guided by the Mental Disorders Act of 1951. Mental disordered offenders are expected to be treated in whole government-administered hospital, or they are expected to be treated in government hospitals. Okay, this is to safeguard the life of the patient and also the life of property. So we can have a detention order that can safeguard these prisoners. Okay, that is under Section 3 of the Prisons Act. While prisons focus solely on control, these forensic facilities focus on both control and treatment. When we look at prisons that we have, necessarily they look at the control of crime by ensuring that those that have committed these crimes are institutionalized. Whilst when we look at forensic psychiatry, we also want to offer treatment to these mentally disordered offenders so that they can recover from their illnesses and be able to be integrated within the communities. So buildings are therefore designed for maximum security to prevent these patients from escaping from these mental health detention facilities. Okay, so these mental health facilities are also guarded by prison warders or prison guards. Okay, so in Zambia, there are designated facilities for this, okay, which can be found at the highest mental health facility within Zambia, that is Chainama. We have a facility, okay, that is known to, or that is designated to keep people with the mental illness. So for the purpose of this discussion, I just have to mention that we have Chainama East, okay, as a designated facility or as designated prison for people with mental illness or suspected mental illness. So that is Chainama East. It is used to confine people who have committed homicides or grievous body harm to others as a result of being insane. Like a person, these facilities, okay, are secure environment with strict rules and regulation to ensure safety and security to prevent patients from escaping. Individuals admitted to these places have been charged with criminal offenses and are deemed too dangerous to live in the community. So I'm talking about the prisons or designated places for detention or institutionalizing people with mental illnesses that have committed offenses. We have Chainama East, okay, in Zambia, which is designated for that. So these facilities, and I mean the Chainama East, is also used to care for persons that develop mental disorder and therefore require psychiatry treatment and care while still in prison. Okay, you can have someone who has been admitted in prison and then they develop mental illnesses. So they will be changed of prison to a psychiatry treatment prison or facility. Those who have committed violence against property as a result of insanity are kept in the acute wards. Okay, and these are designated facilities within Chainama. Okay, so that is the acute ward. Those that have committed violence against property as a result of insanity. Then female offenders are detained in the acute female ward, and they are assigned prison warders for such facilities are female prison warders. Okay, so acute wards are for those that have committed crime, okay, because of their insanity. So we have these acute wards where they have to be treated. Okay, so in treatment of mental disordered patients, you can come up with some terminologies or procedures to do with leave of absence. You can come up with terminologies like absconding and the issue of sexuality. So it's important that we also discuss them, okay, as we are looking at the treatment of patients with mental disorder. So when you say leave of absence, here we are just looking at detained patients that cannot go on leave or be discharged from hospital as long as they are a danger to others or property. So leave of absence, this is a type of leave that can be given to those that have become less danger to others. Then absconding. Absconding, immediately it is noticed that a patient has absconded, the police and natives should be notified, indicating the date, time, circumstances under which the patient absconded and the clothes they were last seen wearing, and if possible the direction which they took. So a search by the police will be instituted, and this should be documented in the nurse's ward report. So absconding is when the patient moves out of health facility without permission. So they move out of this permission without permission, and they just go astray. Then to do with sexuality and treatment of patients, sexual offenses tend to be repeated because patients with the psychosexual disorder may not cooperate with treatment. The most common offense are indecent assault of women, indecent exposure, unlawful intercourse with girls under the age of 16, rape or pedophilia. Okay, so you can look out for the lesson where we have talked about psychosexual disorders. Okay, you find we have talked about pedophilia and other psychosexual disorders. So for this reason, to do with sexual offenses, psychiatrists may be asked to give an opinion on an offender's dangerousness, which if present may lead to long periods of confinement. Treatment of sex offenders can only be carried out if the offender admits of having committed the crime and if he or she is willing to undergo therapy with a view of changing his or her sex offending behavior. Victims of crime are referred to appropriate services where they are given the necessary psychological support available within the community and mental health department. For example, women and the child shelter are there and victim support units are there to help people who are victims to this. Even at University Teaching Hospital Zambia, we have a block necessarily that tries to help the needy, orphans, and Also, there are voluntary counselors and child counselors that tend to help victims with such offenses. Okay, so we've been looking at treatment settings for mentally disordered offenders, and we have said that there's a designated facility, which is China East in case of Zambia, for prisoners with insanity, where they can be institutionalized, or where they can be kept, okay, where there is control and then treatment of these patients. Okay, for those that have committed offenses, due to insanity, they are kept in acute ward until such a time when they can easily be reintegrated with others. Okay, then there are designated groups that can help those with these challenges. Okay, and then we have certain technologies that we may come across as we are taking care of these patients, and that is leave of absence, absconding, and sexuality. Leave of absence, here we are looking at those detained patients that cannot leave or be discharged from the hospital as long as they are a danger to themselves and the property or public. And then absconding is when the patient decides to leave health facility without permission. Then to do with sexuality, we have said that insanity offenders to do with sexuality, such people cannot necessarily be discharged from the hospital until such a time when they are considered to be less of danger to the community, okay, But we also have designated facilities that help with all these things within our community. So that is what we can say about treatment setting for people with mental disorder. We can talk about the facility that is available, and also how tasks are assigned. So these facilities are there for control and treatment. So the female acute ward, for those that with insanity that commit crime, you find that you have female prison warders, and you have also acute ward for male male offenders with the insanity. Okay, male offenders with the insanity. Okay, then we can talk about forensic psychiatry nursing care. When looking at forensic nursing care, I would urge you to look at the other lesson that we have talked about, nursing care of a patient with the mental illness. But still, since we are trying to be specific to do with forensic nursing care, we are going to use B-Care. Okay, B-Care as our mnemonic for care of patients in forensic psychiatry. So B-Care is about B, behavior management of behavior modification. C is for crisis intervention. What might have led these patients to be admitted in this forensic psychiatry is because of a crisis that remained unresolved. Then A is for the treatment that will be given, that is anxiolytic medication that have to be given. Then R is for the rehabilitation that is required for these patients so that they can recover from their condition. Then E is for education on substance abuse and other vices that may lead to mental health condition that the patient may need to be aware of. Okay, so the forensic focus for nursing is therapeutic nursing intervention targeted at patient behavior. Okay, so it's targeted at those psychiatric symptoms that will cause the patient to commit these crimes. So that is our focus in forensic nursing. Nursing intervention, therefore, are directed towards reducing the frequency and the severity of these psychiatric symptoms. You can remember to continue utilizing the nursing process to give individualized care to this patient. But each abnormal behavior will be assessed, a nursing diagnosis made, and the intervention planned and then implemented. But the common intervention in forensic nursing care is the B care. Okay, so these are the specifics that we can talk about. Of course, it is according to my own assessment. That's why I'm talking about the B care: behavior modification, crisis intervention, anxiolytic drugs that have to be given, rehabilitation and education on substance abuse, alcoholism, and other vices that may lead to mental illness. Okay, so the B care here becomes specific and applicable to forensic psychiatry, though we can look at it in different ways depending on our level of understanding of nursing care. Of course, what I'm just proposing is just a tip of how you can care for this patient, because you have to apply the nursing process so that you can offer individualized care. Okay, so crisis intervention. This treatment helps patients cope with the crisis brought about by their criminal behavior and subsequent detention in their lives, and also learn effective ways of dealing with future difficulties. Treatment is aimed at reducing emotional arousal that takes place during a crisis, together with any accompanying behavioral disorganization. This is done by reassuring the patient and enabling the patient or the client to have an opportunity to express emotions in a supportive environment. Of course, where you're going to where you're going to show empathy and be non-judgmental. So crisis intervention, we have looked at this separately as a lesson on the many mental health conditions that we have looked at. So a patient who has, let's say, with insanity, a patient with insanity who has committed a crime may need crisis intervention or may be in a crisis. So crisis intervention measures may need to be instituted. So you can also look at the lesson or listen to one of the lessons where we have talked about crisis intervention. From there, you'll be able to pick some skills that you can apply. Otherwise, the treatment of crisis intervention can help the patient cope with the crisis that has led them to detention. Then anxiolytics, giving of anxiolytic medication. Once emotional arousal has been contained, a problem-solving approach will be used, in which the nurse, in collaboration with patient, helps identify list of problems that are causing the distress. Okay, so you are checking for problem-solving counseling, okay, within the patient, or you're looking at problem-solving. Okay, so anxiolytic medication is to reduce anxiety to avoid the precipitating factors that lead patient to behave in an unusual and undesired manner. So when the emotional arousal has been contained, then you can talk about problem-solving approaches or problem-solving skills that you as a mental health nurse should have. So you can talk about problem-solving skills, okay, with the patient, so that now they can see how they can deal with their problem, because they might have not been in their rightful mental state when they committed these crimes. So you have to look at all problem-solving counseling skills that you can use as a nurse. Then rehabilitation. In order for patient in this setting to be eligible for return to the community, both the criminal act and the psychiatric illness must be addressed. If danger is determined, the Criminal Act specific programs targeting anger management are going to be offered. So rehabilitation is for the patient to return to normalcy. We want the patient to return to normal behavior that can easily be integrated within the community. Then, because of the crime and detention that results because of this forensic case, patient may have some suicidal ideation. So it's important that you educate the carer givers, okay, or you treat the patient for depression and close observation of staff and relatives within the community so that the patient does not end up taking their lives, as being in detention brings about a crisis that can bring about suicidal ideation. So from your assessment, you can look at these potential problems here and be able to help the patient. Okay, then the B in the B care is for behavior modification or behavior management. So any abnormal behavior such as being antisocial, okay, if the patient is unsocial or manipulative, it will be treated using a behavior modification skills that a mental health nurse needs to have. So behavior modification skills in the general nursing care of patients with mental illness, we try to emphasize some of the items that you can talk about in behavior modification. But otherwise, E for the B care is education on substance abuse, okay, and the treatments that are available for people that have been abusing drugs. So in substance abuse treatment, we have detoxification, which is done in psychiatry unit, and thereafter patient is referred and connected to long-term support groups. Okay, so in the care of patient with forensic cases, this we can offer the B care, but we can also apply other items that we have in the general nursing care. So you will see that the nursing care that we have talked about in the general care of patients with mental illness, you can necessarily integrate them within the B care. And when we are talking about all these things, there's no absolute way to say this is the way you care for them, because in nursing there are what we call potential problems and actual problems. So you need to conduct a very good assessment of the patient so that you can assess the patient for the needs of nursing care that they may have. Okay, so the patient, once admitted, you also need to plan how you are going to discharge them. So there is also what we call discharge planning. So you can begin to plan for the discharge of the patient together with him and the relatives with input of multidisciplinary team. The way forward and how the patient can be integrated within the community. So you need to plan the patient's discharge. Okay, that is the patient who has committed a forensic omission. Okay, so otherwise discharge planning is for all patients, whether it's medical case or obstetric case and the likes. There should be some kind of discharge planning. But when you're talking of mental illness and in particular forensic psychiatry, there should be some kind of discharge planning that is led by a multidisciplinary team so that a patient can be effectively treated and integrated within the community. Okay, so now let us look at the special challenges that a nurse faces with forensic patients. Okay, we are looking at special challenges that a nurse can face with forensic patients. Okay, so to discuss this, I'll make just a reference to some of the challenges maybe that a referee may face when is trying to monitor a football match as they are in charge of that football match. We have seen that certain decisions that were made were questionable, and then it was felt of late that they might need what they call video assistant referee, okay, which they commonly refer to as VAR. So what are some of the special challenges that a nurse faces with forensic psychiatry? We will look at it in terms of VAR. But the VAR part here that we are looking at is the violence, okay? The physical, the potential physical violence that necessarily the nurse are going to face. Then The A in our VAR is the abuse. Okay, nurses are likely to be verbally abused by patients with the mental illness. And then the challenges to establish a rapport or difficulties in establishing nurse-patient relationship. So that is the VAR, to do with special challenges that nurses face with forensic patients. Since forensic patients have too many problems, namely the serious crime they have committed and the mental disorder that caused them to commit that crime, the patient becomes very complicated and difficult to manage. In fact, forensic patients are well known as being very dangerous, both to each other and to the staff that are caring for them. So that's why we have VAR as the challenges. So VAR is for violence. So the violence here we are saying it's potential, in that it's not all of them that are violent, okay, but the others may be violent. So the violence can be physical, or it can be physical, or patient or the caregivers may face verbal abuse. Then there might also be difficulties in establishing a relationship. So when you say potential for physical violence, okay, as one of the challenges that the forensic nurses may face is that since most patients admitted to a forensic setting have a history of criminal behavior, they pose a high risk of physical violence to both staff and fellow patients. This can be prevented or reduced by training forensic nurses in violence prevention and management techniques. So please, I urge you to look at the other lesson where we looked at restraining. Restraining is one of the ways that forensic nurses need to have as a skill in preventing violence. If a nurse has been exposed to physical violence, they must be supported and undergo debriefing. Okay, then, we have had a lot of nurses that have been violated in mental health psychiatry, so that is necessarily why we are talking about VAR. We need VAR in these forensic psychiatry units. Then there's verbal abuse. Daily stress of verbal abuse of nurses needs to be addressed so as to maintain staff morale. It is addressed by support from senior nurses, in which the affected nurses are given the opportunity to reflect on and discuss the reaction to the patients. Okay, so verbal abuse because of mental illness or altered mental perception. Patients with mental illness or forensic psychiatry offenders may verbally abuse forensic nurses or caregivers. Then difficulties in nurse-patient relationship or rapport from our VAR. It's establishing a rapport. Physical or verbal abuse disturbs the forming of a meaningful nurse-patient relationship. To be able to carry out the mentioned activities of nursing intervention, the forensic nurse needs to function in a professional manner. Okay, and some of the functions of forensic nurse may include patient advocate, a trusted counselor, and a provider of primary, secondary, and tertiary healthcare intervention. Okay, so since we talked about discharge planning, it's also important that we also talk about referral and the discharge. Forensic offenders, okay, are reviewed every 14 days by two different psychiatrists under the detention order. Their confinement in a mental disorder tends to be for a long period of time until it is determined that they no longer pose a danger to the public and to the property. Again, this is done by two psychiatrists who get their views from the observation and assessment by nurses, psychologists, and other members of the multidisciplinary team. Okay, so it will be according to His Excellency's pressure. Okay, this is a prerogative of mercy of the President, where he pardons prisoners that have been recommended by both prison and mental health personnel. The psychiatrist we will complete a medical certificate in which a patient's mental fitness is confirmed. It is this certificate that the court will use to either discharge or reduce the sentence of our mental health offender, or the sentence of a mentally disordered patient will be reduced if there is no prerogative of mercy by the president. Okay, there is a certificate or medical certificate that is produced to show that the patient is now fit. And when the president is pardoning some people, some from psychiatry unit can be discharged at this point. Okay, so there you have it. We have been looking at forensic psychiatry. Okay, we looked at some terminologies that are used in forensic psychiatry. We looked at types of patients that are admitted in forensic psychiatry, and we looked at the nursing, special nursing care that is offered in forensic psychiatry. So the focus of forensic psychiatry is assessment and treatment of mental or mentally disordered offenders and other patients presenting with severe mental disorder in association with a significant behavior disturbance. In Zambia, most of the forensic patients are treated at Chainama Special Hughes Hospital or Chainama Hughes Hospital because it is the place designated by the Zambian Constitution for the forensic treatment and assessment. So in this presentation, we have defined the key terms that were used in forensic psychiatry, outlines the types, describe the forensic psychiatry care of the patient. Remember the B care that we have talked about, that can be integrated with the other type of nursing care that we have discussed in other lessons to do with the general nursing care of the patient. Okay, so we have talked about all these items. So the last part, which is part 3 of our lesson, we were looking at the treatment setting for mentally disordered offenders, and we identified Chainama East as one of the government designated hospital where people with mental illness and they have done some kind of criminal act. This is where they will be detained. So those that have committed crimes due to mental illness, they will be in the acute ward. Okay, and for males, they will have prison warders who are males, and for females, they have prison warders who are females that will be looking after them. So the facility is Chainama East. Then some terminologies that we can come across during the treatment is leave of absence, absconding, or offenses to do with sexuality. Okay, so the leave of absence, on this part we are saying detained patients cannot go on leave or be discharged from the hospital as long as they are a danger to the public, also self. Then absconding is when the patient leaves before they are discharged from the hospital. So absconding, here we are saying if a patient absconds, necessary information should be given and the police will look for this patient so that they can return to the prison. Then to do with sexuality offenses tend to repeat themselves. So until this person who committed this sexual offense because of mental illness is as fully recovered, that is when they can be reintegrated within the community. Okay, then forensic psychiatry nursing care, here we came up with the B care. Okay, that is to do with behavior modification, okay, crisis intervention, giving of anxiolytic medication to the patient, and also teaching them problem solving. The anxiolytic drugs are meant to contain the emotional arousal of the patient, then rehabilitation of the patient from whatever worsens the condition, and also educating the patient about suicide prevention and drug abuse. Okay, then we also looked at discharge planning. So in discharge planning, we looked at the special challenges that a nurse may face with forensic patients, and we identified VAR, that is to do with potential physical violence, okay, verbal abuse, and also difficulties in coming up with a rapport. So it is important that when you admit a patient with mental illness, you have a plan. So this plan is to allow you to discharge the patient only when they can be reintegrated within the community without committing crime. Then referral or discharge, forensic offenders are reviewed every 14 days by 2 different psychiatrists under the detention order. So their confinement is that is in a mental hospital, tends to be for a long period of time until it is determined that they are no longer of danger to the public and also to the property. Otherwise, for those with a medical certificate showing that they can be reintegrated within the community, they can end up being discharged from this facility using His Excellency pressure. Okay, that is the prerogative of mercy of the president. Or their sentence can be shortened because the medical certificate is there and these are patients with mental disorder. So that is what we looked at in part 3 of forensic psychiatry. If you are to appreciate our lesson on forensic psychiatry, you should listen to part 1, part 2, and part 3. After listening to all these, then you can try to attempt some questions on forensic psychiatry and see how best you can answer and be able to add some of our points to our presentation. Of course, there might be other things or angle that we might not have looked at, okay, that your question may have. So you listen to all the parts and then attempt a question to help you to understand forensic psychiatry. Otherwise, we have the comprehensive lesson on forensic psychiatry in nursing or psychiatry or forensic psychiatry for those that are doing just psychiatry. Okay, my emphasis was so much to do with forensic psychiatry in nursing, but I know it's going to also benefit other professionals that have forensic psychiatry component. So from me, I'm saying thank you and keep studying.